Congress remains deadlocked on a plan to address rising health care costs and expiring Affordable Care Act tax credits. Our Washington, D.C. correspondent Brendan Scanlon live tonight on Capitol Hill, where the Senate considered competing health plans this afternoon. Brendan, good evening.
Hey there, Mike. Good evening to you. And both of those plans failing on the Senate floor earlier today. The Democratic proposal was a clean 3-year extension of those enhanced Affordable Care Act tax credits, and Republicans had an alternative proposal, one that promoted health savings accounts in an attempt to give money to the consumers instead of giving them to the insurance companies. As we said, though, both bills failing to reach that 60-vote threshold necessary to pass the upper chamber. The clock continues to run out on Biden-era enhanced ACA subsidies set to expire at the end of the month.
If Republicans do not support an extension of the tax credits, as many as 1.7 million New Yorkers will see their health care costs skyrocket in the new year. Nationwide, we can expect to see a staggering 21% increase in the number of uninsured Americans if Republicans allow these tax credits to expire.
But Republicans believe their plan without a tax credit extension gives consumers more flexibility.
Why would Democrats want to give all the money to the insurance company as opposed to all the money to the patient?
Instead of sending billions to insurance companies, Republicans propose depositing up to $1,500 into health savings accounts.
That's not going to do nearly enough to offset the premium increases for many families.
Former Deputy Director of the National Economic Council, Daniel Hornung, says if subsidies lapse, many people may be forced to drop insurance altogether, which could put a strain on hospitals.
More and more patients coming in, not able to pay for the services that they're getting in emergency rooms, and that level of uncompensated care, particularly for hospitals that are already struggling, rural hospitals, inner city hospitals, is not something that they can avoid. So we will see hospital closures as a result of these changes over time.
Still, Republicans remain adamant about rooting out waste, fraud, and abuse while opening the window for reform.
You can't just do a blanket extension without reforms. It is rife with waste, fraud, and abuse.
It's going to take more than a few days to figure out how to reach those kinds of reforms. The challenge over these next few days is how to prevent people's premiums from going up on January 1st.
And Mike, over in the House, several bipartisan proposals have emerged from more moderate Republicans and Democrats, offering sort of a compromise between those two competing bills that we saw fail in the Senate today. However, time is running out. Lawmakers are leaving for the holidays after next week. And if they can't agree on a compromise, then those higher premiums could become a reality for millions of Americans. Reporting live on Capitol Hill for Erie News Now, I'm Brendan Scanlon.